Good morning, Dr. Lebowitz at the Long Island Gynecology Center in Long Island, New York. So I've got this young man, he's 30 years old exactly, and he comes in from California for full body, high definition, dynamic body contouring, liposculpture, and to etch, reveal, define, and contour his entire torso. So he had gynecomastia surgery done when he was in his early 20s, about 8 years ago. And they did a pretty good job. He's got some fullness there, but I don't know what he looked like before. And I guess also it was when he was like 21 or 22. So, you know, I'm sure he was a little leaner at that time and stuff, but maybe not. But lift up your arms. So you can see that the gland is gone, okay? There's a little indentation, and that's pretty normal after gland removal, because when you drop your hand, the muscle fills in that space. So that's pretty good, and the scar is pretty darn good. So the guy who did this in California did a pretty good job. This side has a little bit more fullness, and he complained that to me, that this side, when he drops it, is a little bit more fuller than this side. And the reason why is to lift up again. This has more of an indentation, this side doesn't. So there's a little bit of scar tissue here. He wants to make sure, and he's obsessing about if there's any gland in there. I'm telling him probably not. It's more scar tissue or fat. But I'm going to make a little incision there. I'm going to stick my little pinky in there and just make sure, because he wants to make sure. If I don't do that, I think in his mind he'll always obsess that, oh, there's gland in there. But if I say no, I opened it up, it's fine, it's perfect, he won't obsess as much about it. And also, if he just came to me, like if I did the surgery, and he complained a little more fullness, I would just do steroid injections, and I would send it to him in California, and we would do it together over video, over FaceTime, Skype, or WhatsApp, and that would destroy whatever is bothering him to mimic this side if I did the original surgery. So if somebody came to me with this, I would just recommend steroid shots to break up the scar tissue, and that would be perfect. But this side is great, this side just a little scar tissue. All that said, he's really coming here because he wants his whole body contoured. He wants a six-pack, too much loose skin and fat here. He wants to etch the lats, the pecs, the lateral obliques, the semilunaris, and turn around. The love handles, there's a little too much skin, loose skin, and some fat by the lats back here, and more definition. That's kind of what he's coming. There's plenty of doctors in California, of course, but he researched and he selected me as his surgery. I'm the only one who will be doing this, or could do this, under local anesthesia, because I do more of a dynamic, and I want to mark him dynamically, meaning that the muscles move with him, so the contouring is not artificial. It's real muscles and really contouring to etch and reveal the muscles beneath what, you know, he's got muscles beneath some of this fat and loose skin. So all that said, I'm going to mark them, numb them, into the OR we go. And again, all my incisions are stealth. In the armpit, by the nipple, inside the belly button, in the groin here. And if we flip them over, I'm going to do it in the armpit back here, and one just above his butt crack to get this. I have my curved cannulas, and I'm going to reveal these, what do I call them? The
dimples.
The dimples, the venous dimples right there, and get the paraspinal muscles to really give them an athletic back. And two, for this up here, the trapezius and stuff, that he's got to work on. That we really don't liposuction on that, because there's not much fat here. That he just has to build up muscle up on top. So let's do it. Right, so here markings are so important, and they're very intricate and whatever the word is. So we're gonna do the midline here. Okay, so I'm gonna frame him first. Do the lift up your arm. Do the semilunaris, and that's the semilunaris is the edge. Sorry if it's ticklish, actually. The edge of the what do you call it? Of the what are these? The rectus abdominal muscles. And this begins with the V to P, okay? We're not going to expose him like that. Okay. Next, come on down. Put your hand on my shoulder and push down. See that? That's the pectoralis major muscle. And this is kind of nice. Look at that, really. That's a beautiful shape there. Let's do the other side. push down. There we go. It's really excellent. So I want to maintain volume here. I don't want to really get anything up here whatsoever. I want to maintain volume. And I got a lot of guys who say, oh, doc, I'm still too big up here. I mean, listen, I know some doctors in California who injects fat here to make them bigger. So you have to have volume here. Otherwise, you look like you're 10 years old, like Darren here, you know, no muscles, and the sorry about that. And the nipples droop. You need volume here. So don't tell me when I operate on you, oh doc, I'm too full up here. You need fullness there. You need it. All right. Now let's go sideways. Let's just do the lift up here. So the lats are back here, and you can kind of see that. That's the lats. Do the same thing. Let me mimic each side. Do the lats. So that's the lats here. So that's perfect. Okay. Now come up here, do laterally, just so I know where the lateral line is. Come over here, where the lateral line is. Okay, now switch over back here. Now show me your lats back here. Pull down on here. So here is the lats here. Okay, so that's the lat here. Pull this down here. And that's the lat here. And lats have, you know, superior, medial, and inferior heads on that. Good. The midline here, coming down to the butt, right there. Speaking about butts, want to maintain volume of his butt. Again, I know doctors who put fat in guys' butts, which I think is pretty cool. But my own fear of that is if you put too much in guys or girls, over 10 years, the fat, you can relax for that, the fat drops and you get like a wet diaper look, if you know what I mean. Wet diaper? No? Now tighten your back muscles. How do you do that here? Just want to see your back like, All right, so the paraspinal muscles are like that. And the venous dimples, squeeze your butt cheek. Yeah, venous dimples are right there. So this little triangle, we're going to get paraspinal muscles up north there. Cool. All right. And I did this. Okay, good. Now let's further etch. Now tighten your muscles. So you can kind of see where a six pack is. Right there. Relax, breathe. Do it again. You can kind of see where these creases are. Good. One's a little higher than the other. And this is going to be like this. Good. And that. Good. And the third one is going to be there. Okay, breathe. Woo! All right. So here we go. Here we go again. Good. Again, we're doing dynamic ones. Now, here are the lateral obliques, okay? So let me see where his butt is again. So that is butt here, going here. Don't expose him. Come over here. Good. Okay. Good. So all this is going to go, and this. Now, the lateral oblique and the hips, okay? So here's a line I'm seeing here, okay? And here's the same line that I'm seeing here. So the lateral obliques right here. Now twist and turn. Let me see. Suck in your belly. Yeah, hold on. Tuck in your belly and turn. Let's see. Yeah, see this I need to reveal a little bit better. Yeah, turn sideways. Relax for a second. Stealth incisions here, 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 and there, okay? We're gonna reveal these muscles, okay? So the six pack, 2, 4, 6. Get rid of this. Really give him that great V to P, if you know what I mean. Maintain volume up here, but etch and define his pectoral region perfectly. The lats back here, thin it down. He's got some fat and stuff, but thin it down, but give him some nice definition here. The lateral obliques, I want that, but it's a little too much. So we're gonna etch those are out there down to his hips. And going to the back, we're gonna get these lats, a little too much there. Get the lats down, and give him the paraspinal muscles to give him an athletic look. The venous dimples. He's going to look. I'm not going to put scars there. Actually, I saw a friend of mine put scars there in a female, but I don't want scars there. I can etch those nicely. Good. And then maintain volume on his buttock. We're not going to put any fat there because, I don't like doing that. I mean, you can for a soccer butt, but he's got a good butt.
He's got a good butt.
And in years down the road, you get that wet diaper look. You put too much in, it sinks.
So like Kim Kardashian look?
Yeah. Oh well, but she.
No, hers. I think she
keeps up with it.
Yeah, she revises it all the time.
Yeah.
When you start getting dimples in it, she gets more.
Right. Yeah. Yeah. And you can also get it sucked out and then put it back in. It's all.
It doesn't stay where you put it.
It doesn't. It gravity.
Right. Exactly.
He's all numbed, and we're going to break up a little bit of scar tissue from the old surgery. He thinks there's a little bit of gland there. I don't think so. I think it's just scar tissue. But this one has that little indentation, which is normal. But I want to just break it up a little bit.
5 minutes.
5 minutes. The belly even less so we did 5 liters?
5.
Good. So I'm above the muscle here. That's my lats here. And I want to etch the edge of the muscle. Every muscle counts. Do not want to liposuction anything up on north because I want to maintain volume. And guys, their heads are so wrapped up on their chest that they don't realize that the pectoralis major is support for the nipple and everything. You have to keep that. I can't liposuction up there. Otherwise, I'll tear the muscle and this and that, and people just don't understand that. And sometimes I get these weird requests for me to do that, like get the muscle out or this and that, and I just can't do that. So anyway, right here is a new one too. So now I'm getting down to the groove between the lats. Get down to the lats back here. Above the lats, just tighten it up. Underarm right here. It's the Mercedes 40 millimeter, which allows me to go all over the place through my stealth incisions. So here we go.